Measurement of mortality. Mortality data is relatively easy to obtain because most of the countries have a routine system of reporting deaths, and most of the government release such mortality data in form of tables. So it is easily available. International Death Certificate. The death certificate forms the basis of mortality data, the study of number of deaths and in the causes of death. So hence, for ensuring the national and international comparability on the causes of death and number of deaths, there is a need to have an international death certificate which is uniform. And it also requires uniform coding of the diseases so as to record the correct cause of death. And hence there is a uniform recording, there is a uniform classification of deaths by WHO which is periodically updated. This is the International Death Certificate that is recommended by the WHO for use in all the countries. Note that there is a line A in the cause of death, line B and line C. There is section D in the second part of cause of death. Line A records the immediate cause of death. Line B records the first antecedent cause of the death. Line C records the underlying cause of death, and this underlying cause forms the essence of the International Death Certificate. Definition of the underlying cause is the disease or injury which initiated the train of morbid events that led directly to death, or the circumstances of the accident or violence which produced the fatal injury. Line D records the associated health conditions which may have indirectly or directly contributed to the mortality. The death certificate used in India has a set of questions added to the International Death Certificate. These questions are 1 and 2. These questions have been added to provide an alternative source of maternal mortality data. Limitations in the use of mortality data. All the deaths may not be reported in some countries. In some cases, the medical certificate may not have been issued. In cases where certification has been issued, there may be lack of accuracy because of incorrect entry of the age of the dead or incorrect entry of the underlying cause, which may be due to lack of diagnosis, due to inadequate lab facilities or lack of postmortem, or the entry may be incorrect because the certifying doctor is not sure what to use as the underlying cause. Choosing a single cause of death, the compulsion to choose a single cause is also a limiting factor. The coding systems of the disease may change over the years, and the disease with low mortality cannot be studied, obviously. Crude death rate is examined first of all. Crude death rate is defined as the number of deaths during the year divided by the mid-year population into 1000. Crude death rate is determined by two factors: the population composition, whether you have a large proportion of young people or a large proportion of the elderly, and the age specific death rate. Why is crude death rate called as crude? We shall now answer this question. Crude death rate is crude because it lacks comparability between countries which have different composition of the populations. Like Japan has a higher proportion of the elderly, whereas developing countries have a very large proportion of young individuals. And also the effect of composition of by sex, by race also affect the final figure of crude death rate. How the population composition affects the death rate, good examples can be found in various books. Still, crude death rate is the first index to be examined in study of mortality data. On the other hand, there are specific death rates. like cause or disease specific death rates, for example death rate due to tuberculosis, death rate due to cancer, or group specific death rates like age specific death rate, sex specific death rate, age and sex specific death rate, etc. Cause specific death rate is defined as the number of deaths from the specific cause during 1 year divided by the mid-year population in that year into 1000. Examples are death rate due to cancer, the number of deaths due to cancer in a year divided by mid-year population in that year into 1000. Another example is death rate due to road accidents. Age specific death rate, number of deaths in the specific age group in a defined population divided by the mid-year population in the same age group in that year into 1000. Example, death rate in 15 to 20 year age group. Number of deaths in the age group of 15 to 20 year old in a defined population divided by the mid-year population in the age group of 15 to 20 years in that year into 1000. Group specific death rate example, male death rate. Number of male deaths in a population in a year divided by mid-year population of males in the same year into 1000. An example of age and sex specific death rate is the number of female deaths in the age group of 15 to 44 years in a specified population divided by mid-year female population in the same age group in that year into 1000. Death rate for a month is number of deaths in that month into 12 divided by the mid-year population into 1000. Similarly, weekly death rate would be number of deaths in the week multiplied by 52 divided by mid-year population into 1000. Advantages of specific death rates: they allow comparison between groups because it's comparison between the similar groups. They identify high risk groups, that is groups which have a higher mortality compared to other groups, and can provide clue to the risk factors or cause of the disease. The differences between a group with high mortality compared to another group with low mortality can provide clues to the risk factor or cause of the disease. The disadvantage of using the specific death rates are that they are possible only if the civil registration system is functioning satisfactorily and if a high percentage of deaths that are reported have been certified medically. Case fatality ratio. Total number of deaths due to a particular cause divided by total number of cases due to the same disease into 100. Note that it is case fatality ratio and not case fatality rate. Why is it ratio? Because it is a ratio of deaths, number of deaths in which the underlying cause was reported to be that particular disease. The data has been collected from the mortality records, whereas the source of the denominator is the morbidity data, maybe from some hospitals or some registry. The sources of data is different, they are just compared. A ratio of reported deaths with underlying cause as that particular disease to the number of cases reported because of that cause into 100. Hence it is a ratio and not a rate. A rate would be when number of cases are followed up and it is seen how many of them die during the treatment. That would be rate. But this is not the case in this. It measures the killing power of the disease and used mainly for acute illnesses like food poisoning, cholera, measles, etc. It is closely related to the virulence of the causative agent of the disease, and the case fatality ratio for the same disease may be different during different epidemics because there may be different in the agent, or the environment might have changed, or the host factors might have changed. For example, the case fatality rates in cholera epidemics in olden time used to be very high. Nowadays, fatality due to cholera is almost unheard of. There are changes in the agent, in the environment due to availability of better treatment, and in host defense maybe. Proportional mortality ratio. It is defined as the number of deaths due to a particular cause or the number of deaths in a specific age group per 100 total number of deaths. It defines the contribution of a specific cause to the total deaths in the population or contribution of a age group to the total number of deaths in that population. Proportional mortality ratio from a specific disease would be number of deaths from the specific disease in 1 year divided by the total number of deaths during the same year into 100. Under 5 proportionate mortality rate is number of deaths in the under 5 year age group in the given year divided by the total number of deaths during the same year into 100. That is what percentage of total deaths are under 5 years of age. Proportional mortality rate for 50 years and above is number of deaths in persons aged 50 years and above divided by total number of deaths during the same year into 100. Can you think of a mortality rate which is higher the better? In previous discussions, following answers have come up. A high percentage of deaths are in the elderly age group. A high percentage of deaths are due to a cause which is both unpreventable and untreatable. So all the preventable and treatable causes have been controlled and a high percentage of deaths are occurring due to this unpreventable and untreatable cause. Can you think of any more? Survival rate is defined as the proportion of survivors in a group which is studied and followed up over a period. It is used for assessment of a new therapy. Survival is counted from the date of diagnosis or from the date of start of treatment depending upon the study design. Survival rate is typically used in cancer studies, that is comparing the old therapy, the survival rate of the old therapy with the survival rate of the new therapy. The formula is 5-year survival rate, total number of patients alive 5 years after diagnosis or start of treatment divided by the total number of patients which at the beginning into 100. Similarly, we can calculate 10-year survival rate, 20-year survival rate depending upon the disease and the therapy. Standardized rates. We discuss that the crude death rates of two populations with different age compositions are not exactly comparable. But if we still want to compare the death rates of these two populations, what can be done? Age adjustment can be done, also known as age standardization. This removes the confounding effect of the different age structures. Similar adjustment can also be done for other factors like sex composition, race composition, parity, etc. There are two methods of standardization: direct standardization and indirect standardization. More detail and the steps in the calculation of standardized rates would be covered in a separate lecture. Spot the difference. The numerator is the same in all three of the following, that is cause specific death rate, proportional mortality rate and case fatality ratio. The numerator is number of deaths due to a particular cause. The difference lies in the denominator. What is the denominator for cause specific death rate? It is mid-year population. The denominator for proportional mortality rate would be total number of deaths, and for that, for case fatality ratio, the denominator would be total number of cases due to the same disease.